Circulatory, lymphatic, and immune systems. The circulatory system, so the circulation occurs in two large loops, the pulmonary circulation and the systemic circulation. The pulmonary circulation carries blood between the heart and the lungs for the gas exchange, where the systemic circulation carries blood between the heart and the rest of the body tissues. The heart, it is a muscular double pump which is located in the thoracic cavity, and it is surrounded by a thin membranous sac called the pericardium sac. The heart wall has three layers, has the epicardium, which is the outer layer, the myocardium, which is the thick layer, and the endocardium, which is the innermost layer of the heart. The heart also has four chambers. They are left and right atria and left and right ventricles. The tricuspid valve separates the right atrium, and the right ventricle separates the left atrium from the left ventricle. The aortic semilunar valve separates the left ventricle from the aorta. Circulation through the heart. Contraction of the right ventricle forces blood out through the pulmonary semilunar valve, through the pulmonary trunk, and into the left and right pulmonary arteries. Returning to the heart via the left and right pulmonary veins, oxygenated blood enters the left atrium. Contraction of the left atrium then forces the blood through the mitral valve into the left ventricle. Many of the major arteries in the body branch directly from the aorta. Arteries branch further into arterioles, which then lead to capillary beds within the tissues, where the blood releases its oxygen. Contraction of the heart and blood pressure. So each heartbeat or cardiac cycle will include a contraction and relaxation of each chamber. The systole, or the contraction, develops pressure and forces blood through the system, where the diastole, or relaxation, allows the chamber to fill again. The two atria contract together, as do the two ventricles. The atrial systole occurs slightly before the ventricle systole and is not as forceful. The blood vessels. We have arteries and veins, and they have three layers that surround the lumen. We have the tunica adventitia, or the outer layer, the tunica media, or the middle layer, and the tunica intima, which is the innermost layer. Capillaries have only the tunica intima. The lumen is the hollow space through where the blood flows. So think about like the vein. That's kind of where it's flowing through. Arteries carry blood away from the heart. So arteries have that oxygenated blood, and it's bringing the oxygen throughout your body. Arteries have a thick muscular wall that can expand when blood is pumped into them, and then contract and maintain that flow and pressure during diastole. Arteries are located deeper than veins, but can be found by feeling for a pulse. So if you hold your wrist kind of directly under your pointer finger, you can usually feel a pulse right there, and that would be an artery. Arteries branch into smaller arterioles, which branch to form capillaries. These arteries are built to withstand a high blood pressure, which is generated by the ventricular contraction. Capillaries. These are single layer of cells that allow rapid diffusion of the gases and nutrients between tissues and blood across that capillary membrane. In its chemical composition, capillary blood is more similar to arterial blood than to venous blood, especially in warm tissue where blood flow is rapid. So capillaries actually form meshworks, which are called capillary beds, which then permeate the tissues. Veins carry blood toward the heart. So this is after the oxygen has been deposited wherever it needs to go. It's coming back into the heart, and that is by a vein. The venules join to form larger veins. Veins have thinner walls and less muscle than arteries. And veins also have valves within them at various points along their length that are pushed closed when blood flows back against them. So sometimes when drawing blood, you can actually get next to a valve with the needle, and you can tell because when the blood is filling the tube, it'll kind of spurt. It'll go in, it'll spurt in and then stop, and then spurt in and then stop. And that's when you know you've hit a valve. So you'll want to kind of back up the needle just a bit when that does happen. Veins of the antecubital fossa. So there are 3 superficial veins on the anterior surface that we use for blood draws. We have the cephalic, the median, and the basilic. The antecubital fossa is the area just distal to the elbow joint where blood is usually drawn. And if you look at it, these veins kind of form a letter M a little bit. It's important to note that the exact anatomy of this region may vary considerably from person to person. So if you look at my arm versus your arm and versus the diagram that you're looking at, it's not going to look exactly like that, okay? So that's kind of where our being able to feel the veins come into play. You know about where to look. This is actually going to show you. There are major arteries and veins of the human body. So some of those major arteries are the aortic arch, the posterior tibial, radial, and ulnar arteries. And then you have some major veins, which are the carotid vein, axillary, cephalic, and femoral vein. So blood pressure, back to that, it will differ markedly at different points in the circulatory system. So we have some definitions for you for blood pressure. We have the systole, which is the contraction of the heartbeat cycle that develops pressure and forces blood through the system. Then you have the diastole, and that's the relaxation of the heartbeat cycle, and that is where it allows the chamber of the heart to fill with blood again. And then the blood pressure cuff, it measures the blood pressure. There are some diseases of the heart and blood vessels. Some of these are, you have aneurysms, strokes, coronary artery disease, rheumatic heart disease, hemorrhoids, varicose veins are all considered diseases. All right, so blood. Blood is composed of plasma, which is the liquid portion, and cellular components called the formed element. So you can see on the picture there, that top part, the 55% is plasma. That is the liquid portion of your blood. That less than 1% there that you might not be able to see is called the buffy coat, and that is actually your platelets and your white blood cells. And then that red part, the 45% down below, is erythrocytes or your red blood cells. So when you centrifuge blood, it spins around very, very fast. And what it does is it actually separates from the heaviest, which goes down to the bottom, up to the lightest, up to the top. So you have your erythrocytes down at the bottom, all the way up to your plasma, which is just the liquid. Plasma, as mentioned before, constitutes 55% of your volume of blood. Plasma is composed of 90% water and 10% of dissolved proteins, amino acids, gases, electrolytes, sugars, hormones, lipids, and vitamins. The most significant element of plasma are going to be your albumin, your antibodies, and fibrinogen. And plasma also contains complement and electrolytes. The plasma sample is usually collected in a tube that contains an anticoagulant, which is a chemical that keeps the blood from clotting. Immunoglobulins or antibodies are important parts of the immune system, and then fibrinogen is actually responsible for blood clotting. And then we have serum. Serum is plasma without its clotting factors. So how that happens is serum is formed when blood is collected in a tube and it is allowed to clot within that tube. So there is no additional additives or anticoagulants in it. It just sits in the tube, lets it clot, and then once it's spun down, those clotting factors are actually stuck essentially to those red blood cells, so they are no longer up in the liquid portion, which we call serum, because it doesn't have the clotting factors in there. So that would be the difference between serum and plasma. There are formed elements as well, and that comprises 45% of your blood volume. Of these, 99% are actually red blood cells, and then the rest, less than 1% or so, is about white blood cells and platelets. All blood cells are formed in the bone marrow from the division of long-lived progenitors called stem cells. These red blood cells carry hemoglobin, which is the iron-containing oxygen transport protein that gives blood that red color that we know. There are 5 million red blood cells in a microliter of whole blood, so that's a lot of red cells floating around in your body. A single red blood cell remains in the peripheral circulation about 120 days before being removed by the liver, the bone marrow, or the spleen. So when red blood cells are forming, they initially contain a cell nucleus. But as the red blood cell matures, the nucleus is expelled shortly after formation. And that is as soon as the red blood cell loses that nucleus, it is called a reticulocyte, which is not a fully formed red blood cell, but it is kind of a teenager red blood cell, if you will. White blood cells, these help to protect the body against infection. There are usually 5,000 to 10,000 white blood cells in a microliter of whole blood. And at any time, most white blood cells are not in the blood, but in the peripheral tissues and lymphatic system. The lifespans of these white blood cells vary depending on the type. And these 5 types that we see often are neutrophils, eosinophils, basophils, monocytes, and lymphocytes. So white blood cells are produced in the bone marrow just like red blood cells. They're also produced in lymph nodes and undergo a complex maturation process, which may involve the thymus and other organs. Another important feature of white blood cells is their ability to recognize specific molecules on the surface of infectious agents and to distinguish them from markers on the body's own cells. So basically, we don't want the white blood cells to attack our own body. We want them to attack bacteria and foreign things that come into our body. Platelets are created in the bone marrow from megakaryocytes. For every 1 milliliter of blood, there's about 200,000 platelets. Platelets remain in circulation in your body for about 9 to 12 days. And they are also called thrombocytes, so you may hear that in relation to platelets. But actually, platelets are not cells. They are simply membrane-bound packets of cytoplasm. So they don't have cellular components like the other ones do. Hemostasis refers to the processes by which blood vessels are repaired after injury. There are 4 phases of hemostasis. So you have vascular phase, which is the rupture of a vein or artery causes an immediate vascular spasm or contraction of the smooth muscle lining the vessel. And then you have the platelet phase. In this phase, there is an exposure of materials beneath the endothelial lining that causes platelets to stick to the endothelial cells almost immediately, and that process is known as adhesion. And then you have the coagulation phase, which involves a complex and highly regulated cascade of enzymes and other factors whose activation ultimately results in formation of a blood clot. And the last step is fibrinolysis. So as the wound is closed and tissue repair starts, fibrin itself is broken down slowly, and that is how your body is healed, essentially, from a cut or something like that. All right, so the vascular phase. We mentioned this already, but the contraction will last about 30 minutes for this. So like we said earlier, it's a rupture of a vein or artery, which can cause that immediately vascular spasm. This can reduce the vessel diameter, which substantially reduces blood loss that would otherwise occur. The platelet phase, again, the aggregating or platelets starting to go together can become activated. It will release factors that promote fibrin accumulation in the next phase. And the combination of the vascular phase and the platelet phase is called primary hemostasis. The coagulation phase is a cascade of enzymes and factors that ultimately result in a blood clot or a fibrin mesh. So kind of if you think of like a scab type situation. Coagulation is initiated by the release of the tissue factor. Other plasma coagulation factors contact the materials exposed when the blood vessel is damaged. And then the last step is fibrinolysis. So we have fibrin degradation products that are monitored to diagnose dissemination intravascular coagulation, or basically when your body produces clots uncontrollably, which we don't want in our body. Fibrinolysis is controlled by plasmin, which is an enzyme made from plasminogen by tissue plasminogen activators. So as the wound starts to close and the tissue starts to be repaired, the fibrin starts to break down, and that is what's known as fibrinolysis. There are certain blood disorders that can also be caused by platelets and hemostasis and clotting, red blood cells. So hemostasis, platelets, and clotting blood disorders, we have the hemophilias. You have that disseminated intravascular coagulation, which is what I talked about earlier, where you have the uncontrollable production of blood clots in your body. You have thrombocytopenia, where they're not making enough platelets, or you have thrombosis or deep vein thrombosis, which is where there is a blood clot in your body. And then we also have disorders of your red blood cells and hemoglobin. So anemia, they just are making too few red blood cells. Polycythemia, which is too many. Sickle cell disease, which is red blood cells that just don't function appropriately. And same with thalassemias. White blood cells also have disorders. So bacterial infections, HIV, certain leukemias, and mononucleosis are all disorders of your white blood cells. And there are also disorders of the immune system, so rheumatoid arthritis, systemic lupus, multiple sclerosis, and severe combined immunodeficiency. There are laboratory tests, luckily, that help us detect these blood disorders. So for hemostasis, platelets, and clotting, we can do a what is called an activated partial thromboplastin time, or a PTT, or a prothrombin time, also known as a PT. You can also do fibrin degradation products, D-dimers, fibrinogen, CBC, which is a complete blood count, and a protein C and protein S. For red blood cell and hemoglobin blood disorders, we can look at the reticulocyte count. Remember, those are kind of the teenagers of the red cells. They're not fully mature yet, but they're also not the baby cells. Iron studies, CBCs, and we can also check the vitamin B12 and folate levels. You can also do a sickle cell solubility, hemoglobin electrophoresis, and CBC as well. For white blood cells, we can do a CBC with differential, and what that means is we're going to do a full complete blood count, and we're also going to do a differential where we look under the microscope and we look for any abnormalities for red blood cells, white count, things like that. We're also going to then differentiate the different white blood cells that we mentioned earlier, like your neutrophils, lymphocytes, monocytes, things like that as well. Bacterial cultures, you can do HIV antibodies. We can also do some cell marker studies or a monospot test as well. For disorders of the immune system, we can do rheumatoid factor, we can do anti-nuclear antibodies. There's a whole bunch of different testing we can do for these. So you just need to remember that as a phlebotomist, you may not need to know the actual reason any particular test is ordered for any particular patient. It's just kind of good to know for your own knowledge of why we may be drawing these, especially if somebody is getting a PT or a PTT. We may need to take some extra care because maybe they need a wrap around their arm because they may be more prone to bleeding and things like that. So just keep in mind, you don't need to memorize these by any means, and you don't need to know, like why or what these are testing as a phlebotomist. All right, the lymphatic system. So this includes the lymphatic vessels like veins, capillaries, and ducts, lymph nodes, and several organs, plus the lymph fluid that flows through the vessels. The lymphatic vessels are closed at their distal ends, unlike arteries and veins. The lymphatic system returns tissue fluid to the circulatory system, in the process screening it for signs of infection, and it also helps to provide a passageway for lymphocytes that kind of patrol the tissues looking for those infections. Lymphatic vessels, so they are closed at their distal ends, called terminal lymphatics. There are small lymphatic vessels that feed into larger ones, and then finally into the thoracic duct, and then that goes into the right lymphatic duct as well. The lymphatic fluid is derived from fluid between cells called interstitial fluid. There are certain lymph organs as well. So lymph nodes is one. So these are chambers located along the lymphatic vessels that are populated by lymphocytes, especially common in digestive, respiratory, and urinary tracts. So your tonsils are particularly a large lymph node. Everybody probably knows about your tonsils and have probably felt them, in your neck before when you've had certain infection. Macrophages can journey to the lymph nodes from infection sites, and they can carry certain molecular samples for examination by B and T cells as well to try to help fight those infections too. There are certain disorders of the lymphatic system. So lymphedema is one, and that's an accumulation of interstitial fluid in the tissues. That's usually as a result of a blocked lymphatic vessel. And then lymphoma actually is a tumor of a lymph gland. So Hodgkin's disease is a type of lymphoma. And then we have our immune system. So we have a non-specific immunity, which refers to the defense against infectious agents, which are independent of specific chemical markers on their surfaces. So non-specific essentially means, something comes in and your body's like, oh, I'm going to go fight it. And it's because they have a certain chemical marker on them and they know to go fight it. Non-specific immunity includes physical barriers, the complement system in white blood cells, which can engulf and destroy foreign cells without regard to their exact identity. So essentially, they don't care what it is. They're going to go try to take care of it on their own. And then you have specific immunity, which involves the recognition of antigens or certain particular markers on the surface of that foreign agent. Recognition of these antigens can trigger activation of those T and B cells. And this would be an example of like a vaccine. So your body has seen it before and it knows exactly what to do. And then we can have autoimmune disorders. And then autoimmunity is essentially an attack on the immune system on the body's own tissues. The allergy is an inappropriately severe immune reaction to an otherwise harmless substance. So some people are allergic to dogs and cats. They're not really causing any harm to us, but for some reason our body thinks that it is. So it's causing, runny noses, itchy eyes, things like that. Severe combined immunodeficiency is an inherited disorder that is marked by almost a total lack of T and B cells. So they don't have those specific lymphocytes to help, take care of it. Certain autoimmune disorders can include rheumatoid arthritis, systemic lupus erythematosus, myasthenia gravis, and multiple sclerosis.